afternoon. I warmly welcome all to the 37th webinar of Parul University. We at Parul University, though facing the pandemic of COVID, have not stopped our webinars and conductions of regular classes. So it gives me immense pleasure today also to come up with this webinar. We have got a core team of 4 principals of Parul University. That is Dr. Purav Desai, the principal of Jawaharlal Nehru Homeopathic Medical College, Dr. Panda Sir, the principal of Parul Institute of Homeopathy and Research, Dr. Hitat Mehta Sir, the principal of Rajkot Homeopathic Medical College, and myself, Dr. Hina Rawal, the principal of Ahmedabad Homeopathic Medical College. Today we have with us Dr. Eng V. Suganthan. Sir is the principal and medical superintendent at Sarda Krishna Homeopathic Medical College, Kulashekram, Kanyakumari, Tamil Nadu. Sir has done his MD Homeopathy in Organon from Rajiv Gandhi University of Health Science, Karnataka, and has done PhD in Homeopathy from Janardhan Rai Nagar Rajasthan Vidyapith University, Udaipur, as well as MBA in Human Resource Management. Sir is the professor in the Department of Practice of Medicine with the teaching experience of 20 years in UG and PG. Sir is a recognized guide for PhD candidate for Dr. MGR Medical University, Chennai. He is on the Board of Examiner and member of Board of Studies of Dr. MGR Medical University since last 20 years. Sir is an examiner at various universities. He is a member of Affiliation Subcommittee of Tamil Nadu. He is a coordinator of Peripheral Pharmacovigilance Center. He is also a member of IQAC. He is a coordinator of Unnat Bharat Abhiyan. He is the president of Institute Innovation Council. Sir is the editor of Homeopathy, the Friend of Health, National Journal on Homeopathy. Sir is the former member of Central Council of Homeopathy. He is a homeopathic consultant since last 25 years. He is the member of Tamil Nadu Homeopathic Medical Council, Inspection Committee member of Tamil Nadu Homeopathic Medical Council. He is the Board of Examiner of Tamil Nadu Homeopathic Medical Council. Sir is also the president of Tamil Nadu Homeopathic Doctor Association. Sir has organized National Homeopathic Seminar in Chennai, Madurai, Salem, Coimbatore, and Kanyakumari. Sir is also the institutional nodal officer of Swachh Bharat and internship program. Sir is the institutional nodal officer of Unnat Bharat and Abhiyan program. Sir is the former chairman of Continuing Medical Education Program of Tamil Nadu. And Sir is in the expert committee member of Indian medicine courses. He is also plays a very important role in revamping the syllabus. Sir is also an expert in the Committee of Excellence in Education at Central Council of Homeopathy. Sir has visited many homeopathic institutes and has participated in numerous conferences, seminars, ROTPs, both as a resource person as well as a participant. There is a long list of these committees as well as seminars and webinars. So if I continue with that, it will take the entire 1 hour. Sir has authored many books also and has written chapters in some of the books also. So it gives me immense pleasure to warmly welcome such an eminent homeopath today in our webinar. Please welcome Dr. Suganthan sir. Please, sir.
Thank you, madam. I am very happy to be a part of this seminar conducted by Parul University on learning disability among school children. I express my gratefulness and thanks to Dr. Hina Rawal and Faculty of Homeopathy for inviting me to this webinar, and also grateful to Dr. B.P. Pandey, my old friend, and Dr. Purav Desai and Hidat Mehta sir. Learning disability among the children is an important focus area which has to be addressed effectively, particularly by healthcare providers. In such a backdrop, our college has been doing a comprehensive school health care program from the year 2000, which invariably includes learning disability among the school children as an integral part of the program. In collaboration and with the support and cooperation of State Education Department and District Administration, we have been conducting various programs, camps, health surveys, etc., focusing learning disabled school children, and follow-up treatment is given to the needy children at our collegiate hospital under multidisciplinary team consists of doctors, clinical psychologists, occupational therapists, physiotherapists, and speech therapists. So far, we have conducted 41 awareness programs and 2000 AD teachers also attended. We have also conducted the training program for teachers in 821 in Kanyakumari district. We have so far covered 10,000 students for screening from 67 schools, which follow-up treatment have been provided 875 school children in our hospital. Learning disability is a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning, or mathematic abilities. The children have an average or above average intelligence quotient, that's IQ, the minimal sensory impairment, and no emotional disturbances. The Washington Summit in 1994, no other disabling condition affects so many people and it has such a low public profile and low level of understanding as learning disability. The main causes, the hereditary and genetics, the problems during intrauterine life and birth, accidents after birth, increased exposure to toxins such as lead. The epidemiology in India, the prevalence of specific learning disabilities is 15.17% in sampled children, and that dysgraphia is 12.5%. Dyslexia is 11.2% and dyscalculia is 10.5%. The prevalence of specific learning disability was reported to be 13% in primary school children. In Karnataka, Kerala, and Tamil Nadu, the prevalence of learning disability and various type of defects of scholastic skills disabilities in 3 to 10% among the students' population. Epidemiology of dyslexia. Dyslexia is the most common form identified in 80% of children with learning disability. The incidence rate ranges from 5 to 10% in clinic and school. The identified samples 17.5% in unselected population based samples in US and other countries. The incident rate is higher incident rate in boys. The early signs are the reading problem, mathematical problem, comprehension, writing issues, spoken language, reasoning abilities, hyperactivity, inattention, and perceptual coordination. The various forms of learning disabilities, that is dyslexia, dyscalculia, dysphagia, dyspraxia, and dysphasia. Dyslexia is a specific reading disability of neurobiological origin characterized by difficulties with accurate and or fluent word recognition and by poor spelling and decoding abilities. Dyscalculia is difficulty in understanding the concept of maths and remembering the numbers, symbols, and math facts. It is usually associated with dyslexia. Dysphagia is a neurological disorder characterized by writing disabilities where a person writing is distorted or incorrect. In children, a disorder generally emerges when they are first introduced to writing. They make inappropriately sized and spaced letters or write wrong or misspelled words despite through instruction. The children with the disorder may have other learning disabilities. Dyspraxia, that is motor difficulty, refers to the problems with movement and coordination, whether it is with fine motor skills or gross motor skills, running, jumping, etc. Aphasia or dysphasia, the language and communication learning disability involve the difficulty to understand or produce spoken language. The language is also considered as an output activity because it requires organizing thoughts in the brain and calling upon the right words to verbally explain something or communicate with someone else. Non-verbal learning disability, the non-language based learning disability, also known as the right hemisphere developmental learning disability, etc., is characterized by a particular pattern of neuropsychologic abilities and disabilities. Characterized by well-developed basic language skills such as phoneme awareness, reading, decoding, single-word reading, and single-word spelling skills. Weakness in visual spatial recognition, weakness in non-verbal problem solving, including social reasoning, weakness in higher order reading, comprehension, and return expression. Our weakness in attention and executive function. Math disability is common. Language-based learning disability, it affects the reading and writing children with language-based learning problems will also struggle with the word problems in maths. A language-based learning disability may or may not include the problems with the reading, decoding, that is phonologic weaknesses. Children with language-based learning disabilities have a relative strength in the ability to perceive visual information, accurately solve problems using visual information, but have difficulty in understanding and using one or several components of language, including vocabulary, phonology, that is discriminating the sounds in words, form, that is grammar, word order, and morphemes, the pragmatics, that is narrative, discourse, and conversation uses. Signs and symptoms of learning disabilities into three categories. The kids at the age of preschool, that is unable to learn numbers, shape, alphabetics, and much more. Difficulty in rhyming, trouble in controlling pencil and crayons, the difficulty in pronouncing words properly, unable to follow directions, the trouble with button and zip, and much more. Age in between 5 to 10 years, they make the frequent errors in the spelling words correctly. Difficulty in understanding the basic concept of mathematics. Confusion in reading words. The learning process is too slow. Unable to remember the sequence. The trouble in making words by blunting sounds. At the age of 11 to 15 years, the bad handwriting, organizational skill or bad, unable to read comprehensions, dislike solving test papers and word problems, poor mathematics skill, unable to express their thoughts. Diagnosis can be made based on the result of the assessments. The child could have reading, spelling, writing, or arithmetic disability, or a combination of any of the above. The initial screening with the Colorado Questionnaire of Learning Disability, assessment of IQ, that is second form board, that is developmental screen test DST, and Vineland Social Maturity Scale VSMS, then assessment of learning disability, that is learning disabilities diagnostic inventorily, that is LDDI tool. The assessment of dyslexia, that is dyslexia screening test, and J and S. The final diagnosis according to the criteria mentioned in the ICD-10 and DSM-4. Test for IQ, the test for intellectual functioning are designed to measure and assess general mental abilities, that is the relative to peers of the same age group, and may include the test of the following abilities: reasoning, problem solving, abstract thinking, judgment, academic learning, and some degree of experiential learning. The intelligence quotient, that is the intelligence quotient, the equal to mental age plus the chronological age into 100. The tests in clinical practice, that is the Sengen Form Board test SFB, and a Vineland Social Maturity Scale, Bennett Comack test BKT, the Wessler Adult Performed Intelligence Test, Batia's Performance Test for Intelligence, Balanced Intelligence Scale for Indian Children, Raven's Progressive Matrices. These are the applications, Sengen formats. Management of learning disabilities. The occupational therapy, educational therapy, speech therapy, social skill groups, solution focused counseling, and cognitive behavior therapy. The individual involved in planning and implementing the interventions, that is the teachers, parents, school psychologists, special educators, speech therapists or pathologists, occupational therapists, psychologists, and reading specialists. Homeopathic approach to learning disability. Homeopathic intervention, when combined with the standard remedial education, has a definite role in bringing about the early change in all parameters of learning disability. Homeopathic remedies needs to be holistically administered, since the learning disability is a developmental disability. The constitutional approach is more satisfied to the children with the learning disability. Homeopathy helps them to cope with their studies and discover their skills. Homeopathic treatment attempts to bring each child to highest level of the health possible in physical, mental, emotional levels. Each child has his own imaginary world where he lives. By understanding the inner world, homeopath can easily enter into their mind through their medicines and brings an effective support. With proper homeopathic treatment, the child will experience more energy, will have a clear mind and a sharp memory, balanced emotions, and also help them to realize the creative power for their growth. They become less dependent, stronger, and more active. The child psychology is studied in homeopathy as a symptomatic manifestation of the constitutional disposition or diathesis. This constitutional disposition expressed in the child's conduct and the reactions may be modified by the homeopathic medicines. The therapeutics for learning disability. The so many medicines we are commonly used in, but most appropriately we are using calcarea phosphoricum, calcarea carbonica, Beretta carbonica, Naxomica, Lycopodium clavatum, Natrum muriaticum, Sepia. These medicines we are commonly used in our day-to-day practice in our OPD, and other medicines are these are the other medicines: Merxol, conium, Fagopirum, Syphilinum, Phosphoricum acidum, Calibromatum, Cannabis sativa, Causticum, Stramonium, Thuja, Medorinum, Carbolicum, Epis mellifica, Scatolum. These medicines are very useful in different conditions. Actually, we are conducting a small study, that is the clinical study on homeopathy for learning disabilities in school children. In our initial stage, the aim of the study to study the efficacy of homeopathic management in treatment of learning disabilities in school children, school-going children, and most effective potency of the indicated medicine. The need for study also, the lack of awareness about the learning disability is one of the reasons for not identifying great talents and potential in children. Acceptance, proper support from the parents and teachers along with the homeopathic treatment and proper nutrition, children and learning disability can succeed the school work and life. The lack of awareness and awareness that homeopathy through its holistic approach help these children and plays a major role in improving their quality of life. This one reason we are first discuss with the school authorities and their teachers, parents. Our first approach also, we are conducting the meeting in the initial parent side, teacher side, and school management side only. After that only we are directly concentrated to the students. The materials and methods, a sample of 50 cases with a learning disability were selected from our OPD of Sharda Krishna Homeopathy Medical College as per the inclusion criteria. The following conclusions were drawn from the study after statistical analysis of the pre and post treatment scores assessed using learning disability diagnostic inventory, that is LDDI tool. These are the methodology. First, we get the permission from the school education department, parents, then screening of the children with, then assessment of the children of IQ, the detailed case taking in case record format. We have prepared a record homeopathic case taking format also. The case processing, analysis, appreciation, medicine selection. Then the selection of potency based on the susceptibility. The reassessment of 6 to 18 months for improvement. The pre and post score statistically analyzed by using the paired test. Actually, this process we are utilizing our house surgeons, internists, and PG students. Then we are a very large group. With the help of the large group only, we can assess this overall problem solved. And result of the study, the majority of the patients belong to the age group of 10 to 11 years of the age, that is 38%. Majority of the cases were males, that is 88%. The majority of cases shows a normal developmental milestone. The medicine which were found to be more effective are Lycopodium clavatum, Calcarea carbonicum, and Silesia and phosphorus. These medicines are frequently used. Homeopathy shows effectiveness in managing learning disability. The conclusion, it could be concluded that the clinical experiences found from treating children with a learning disability and form the public opinion, and homeopathic medicine has a better potential in managing problems in children. This is my presentation, madam. Thank you.
Thank you, sir, for a very informative presentation. Thank you so much. And now I would like to invite Dr. Hidat Mehta, sir, the principal of Rajkot Homeopathic Medical College, to summarize the today's webinar. Dr. Hidat Mehta, sir, please. Dr. Purav sir has joined with us. Initially, he could not join. He is the Dean of Homeopathic Faculty of Parul University, and he is the principal of Jawaharlal Nehru Homeopathic Medical College.
Good afternoon, sir. It was very nice presentation.
Thank you, sir.
Actually, because of some other assignment, I couldn't join in time. And when I reached, the actual session was started by the madam.
Dr. Hidat Mehta, sir. Sir, Panda sir, you can continue, sir. Panda sir.
Thank you, Hina madam. Really, the session was very pleasant and energetic as well as knowledgeful. So this is for the students of fourth year very effective to learn, because the problem is very burning. Different aspect was discussed by Sukandan sir, and the homeopathic aspect and approach also he expressed in his session. Today, what is happening, the late marriage, the genetic problems, and different types of environmental pollution. What I am thinking the main role for this type of diseases, and what is happening, the parents as well as the kids, they are suffering a lot, and also our future nation also becoming a challenge, is a challenge for this type of problems. So, and to solve this problem, what I am thinking, there is a little bit role in other system, but in homeopathic system, as it is holistic system, and we have having miasmatic medicines and constitutional medicines, it can be prevented, it can be cured, or not, if not cured, then the kid can do his regular duty with balance. Second thing, if a mother is having the problem, previous problem is there, the issue can be prevented by giving some constitutional medicines during the gestational period. So, to the learner, to the faculty members and all the students must learn a lot regarding the different types of problems generally arise with the children, and now it was a problem, burning problem for our country. And in Radhakrishna Homeopathy Medical College, sir is doing research on that, and I hope and every colleges we are getting the magazine released by the Radhakrishna Homeopathy Medical College, that is Friends of Health, and regularly the students, they are reading also, they are telling that it is very informative. I would like to request sir, if such type of innovative activities is conducted, then that information should be given in that magazine, that journal. And what I'm thinking, that is a peer review journal, and very effective also. And regarding the dyslexia, it is very difficult in our OPDs also. We are looking after that problems, and the psychotherapy also plays a major role. physiotherapy, psychotherapy, as well as constitutional medicine and ayurvedic medicine also plays a vital role to cure this type of diseases. The case taking part in homeopathy is also very important, what I am thinking, because the history as well as the background as well as the previous treatment or previous diseases in which the parents as well as the kids they were suffering previously also helps us to find out our medicines. And I hope this the guideline which is given by Sugandhan sir and different aspect which was discussed by Sugandhan sir, that is very useful. Now let me give the vote of thanks for today's program. Now Mehta sir is present with us, so I would like to request, we have having time, if he gives some concluding remark on this, then he is most welcome. Mehta sir. Hello. So Mehta sir, are you want to give some concluding remarks on the webinar, or let me give the vote of thanks?
Sir, he is not there. He is not there right now. He had joined, but now I can't see him. Yeah, again he has joined. Yeah.
Mehta sir, are you present, sir?
Yes, sir. I am having connectivity issue. Sorry, sir.
No problem, sir. Now you can give your concluding remark because the time is there with us.
Okay, okay. Thank you very much, sir, Sugandan sir, for giving the wonderful topic and giving a nice talk on the learning disability in school children. And the learning curve for in homeopathic concept, that is the motor disability and aphasia and non-verbal learning disability, which has been very essential in order to cognitive skill as well as the language-based learning disability. We should know the signs and symptoms of the between the pediatric age group, that is much more common between 5 to 10 years of age group. And I am thankful to the sir for providing such a wonderful platform to the student of the Rajkot Homeopathic Medical College, Ahmedabad Homeopathic Medical College, Jawaharlal Nehru Homeopathic Medical College, and Parul Institute of Homeopathy and Research, all the PG students and PhD students. Thank you very much, sir. I am thankful to the management of the Parul University. The director of the Ayush College is Dr. Komal Patel Madam, and Dr. Devanshu Patel sir, President of Parul University. The webinar which has been going to place with the help of the all four principal of the Constituent College of the Parul University, respected Dr. Ina Raval Madam, Dr. BP Panda sir, Dr. Purav Desai sir. So without the technical support of the Parul University, the webinar cannot be possible. So I am thankful to the Brijesh sir and Jiten sir for unflinching support to provide a wonderful network abilities. I am thankful to all the listener and all the students of the different constituent homeopathic college of the Parul University. So we will wind up over here. Stay connected. Wishing you all the best. Thank you, sir.
Thank you.
Thank you so much, sir.
Thank you.
Yeah, we
Thank
will
you, sir.
leave the meeting now. We can leave the meeting now. Thank you so much.
Okay, thank you very much.
Thank you.
Namaste.
Namaste.
Namaste. Namaste.